Knock, knock. Hello, my name's Nolan. I'm a Harper College nursing student. How are you feeling today?
A little rough. I was in a car accident a couple days ago.
Okay, well, I'm going to do a full assessment on you.
Okay.
So we'll figure out if anything's wrong.
Thanks.
Okay, can you tell me your name and date of birth?
Lauren Tote, July 27th, 1994.
Okay, and do you know what year it is?
2017.
Okay, and the President of the United States?
Donald Trump.
Okay, and your ABCs are intact. Also, do you know where you are today?
Doctor's office for a checkup.
Okay, so the patient is alert and oriented ×4, person, place, time, and situation. Skin color is appropriate for ethnicity. The speech is clear. It's normal. Okay, so can you tell me your weight and your height?
140 pounds, 5'9".
Okay, so I would calculate the BMI based off your weight and height. And we did it beforehand, so it's 20.7, which is a normal BMI. Now I would assess your vision using a Snellen chart. Do you wear glasses or contacts?
I do wear glasses. I'm nearsighted.
Okay, so we would assess from 20 feet away with the Snellen chart your vision, wearing whatever corrective lenses you have. Okay, so now I would get a full set of vitals. So I would take your pulse, and I would do blood pressure and temperature and respirations. So then I would start assessing your head. So is it okay if I touch you?
Yes.
Okay, so I'm going to feel the head. You said you were in a car accident. Are you having any headaches?
No.
Okay, so no headaches. There's no bumps or bruises. I'm not feeling any. Did you hit your head at all?
No.
Okay, so I'm also inspecting the hair for anything jumping out at me, any infestations. I don't see any. Head shape is normal, so normal cephalic. Now I'm going to move on to your facial symmetry. So if you could smile, okay, and then frown, and then eyebrows up, and then down. Okay, so the face is symmetrical when she's moving her face. Each eyebrow is raising at the same time, so there's no drooping, which is a good sign. And that's testing for cranial nerve number 7. So now I'm going to palpate the temporomandibular joint. So I'm going to push here. If you could open your mouth. Okay, so there was a crack, so there's some crepitation. Is that normal?
Yes.
Okay, so you have some crepitation of your jaw. Now I'm going to feel your sinuses. If you could just tell me if there's pain. You might feel some pressure when I push down, but if there's any real pain. Is there any pain?
Negative.
Okay. The sinuses are okay. Now I'm going to go to the eyes. So I'm going to sit down, and if you could follow the end of my pen, I'm going to do the 6 cardinal gazes. Keep your head straight and just move your eyes. Okay, so I'm looking at the eyes. They're moving at the same time, and then also accommodation. Just follow the pen. Okay, good job. So that's testing cranial nerves 3, 4, and 6. And also I'm going to test your eyes with the light. It's going to be a little bright light. If you could just look towards me. Okay, so pupils are round, they react to light, and accommodate. So that's also testing cranial nerve 3, 4, and 6. So if you could look up, I'm going to pull down. Sclera are white, conjunctiva is pink, which is normal. So now I'm going to move on to the ears. I'm just going to feel your ears, if there's anything, any pain. Okay, I'm also looking at the ears. There's no piercings. I'm also looking inside. No redness. No excess carumen. Also, I'm going to do a whisper test. So if you could repeat after me, I'm going to whisper, and then if you hear it, say what it is.
Harper College. Harper Hawks.
Okay, so that's testing cranial nerve number 8. Good job. So now I'm going to move on to the nose. So I'm going to put some pressure on your nose. Let me know if you have any pain. You have pain?
Yeah.
Okay, right on this side or this side?
My left side, you're right.
So right here, there's some pain? Okay. Did you hit it in the car accident at all?
The airbag deployed in my face.
Okay, so there is minor bruising on the left upper nostril, so I'll document that.
Okay.
Can you also push on one. And breathe in. Same thing on the other side. Okay, good job. So now I'm going to look at your mouth. If you could open up your mouth, I'm going to shine my light in. So I'm looking at the tongue. Can you put the tongue to the roof of your mouth? Okay. Looking underneath the tongue, I'm looking at the gums. They're pink, moist, no abnormal growth. Teeth are intact. And it all looks pink and moist and normal. Also, your lips look okay. Normal, moist, and pink. Can you stick out your tongue and say, ah?
Ah.
Okay, so I'm seeing the uvula and the hard and soft palate rise. So that's good. That's testing cranial nerve number 9 and 10. Also, can you stick out your tongue? Okay, so the tongue is at midline. It's not drooping to either side. This is testing cranial nerve number 12. And so that's a good assessment. Now I'm going to move on to the neck. So I'm looking at the parotid glands here. I'm not seeing any swelling. I'm also looking at the salivary glands, which are down here. Also no swelling. And then can you look up? Okay. And I'm seeing the thyroid gland. There's no swelling as well. It all looks normal. So now I'm going to test the range of motion. Can you touch your same thing here? Are you having any pain in your neck?
No.
Okay. Just with a car accident, we worry about the neck sometimes.
Yeah, I had some pain, but...
Okay. And you have full range of motion, which is good.
Okay.
So now I'm going to palpate your neck. I'm going to feel here. Okay, so I'm palpating the lymph nodes. So this is the preauricular, postauricular, the occipital is back here, the submental here, submandibular, and the jugulo-digastric, superficial cervical, and the deep cervical chain down here, posterior cervical, and then can you shrug your shoulders up? And this is the supraclavicular. Okay, so now I'm going to feel your carotid pulse. Okay, so I'm feeling a regular rate and rhythm, 2+. I feel this side as well. Regular rate and rhythm, 2+ as well. So now if you could take a deep breath and hold in. Now I'm going to listen with the stethoscope. So deep breath. Hold. Same thing on the other side. Deep breath and hold. Okay, so there's no bruit present. I'm also going to assess the shoulder shrug. So if you could shrug up. And then against my hand, push your face. And this is cranial nerve number 11. So now I'm going to look at the upper extremities. Could you remove your shirt? Okay, so skin looks appropriate for ethnicity. I'm going to feels warm, but not like a temperature, and not abnormally cold. I'm also looking at the back. I'm looking for any lesions. I do see a kind of scar scab forming right here. Was that from the car accident?
Seatbelt.
Okay. So I'm also going to feel each pulse. Can I have your hand?
Oh, yeah.
Okay, so I'm feeling the radial pulse. I'm also going to assess the capillary refill in this hand. So it's less than 2 seconds. I'm also looking at the fingernails for any signs of clubbing. It is less than 180 degrees, which is good. Now I'm going to do range of motion. So can you put your arms out, and then can you hands down, up, open up, okay, and then can you pull towards you, push back down, and shoulders, go up and down. Okay, so full range of motion. Were you having any pain when you were moving there? Okay, can you go like this again, and pull against my hands, and push. Okay, very strong. And now I'm going to look at your chest. So if you could lay down. Okay, so I'm looking at the respiratory rate and rhythm. It's a normal respiratory rate and rhythm. And no use of accessory muscles. And now I'm going to listen. Oh, actually, sorry. Can you sit back up on the edge of the bed?
Yeah.
Okay. So I'm going to listen to lung sounds. I'm also looking at the back for respiratory rate, and it's symmetrical. And now I'm going to listen. So if you could just take breaths a little bit deeper than normal. Okay, now I'm going to listen posterior. Same thing, breaths a little more than normal. Okay, and now I'm going to listen on the right side. There are 3 areas. And on the left, there's 2. Okay, the breath sounds were clear. There were no crackles or wheezing. I did hear bronchial sounds up here and back here. Bronchovesicular more down towards this area, and then the vesicular down here towards the bottom lobes. Now if you could lay down.
Sure.
Okay, so now I'm going to look for jugular vein distension.
Okay.
If you could turn this way and lay your head back. So I'm looking for any jugular vein distension. Not seeing any. Can you go to the other side? Okay. Not seeing any on this side as well. So now I'm going to listen to your heart. I'm going to take the apical pulse for 1 minute. Okay, so I would take that for 1 minute. I heard S1 and S2, no abnormal sounds. Now I'm going to listen to each of the valve areas. So it's the aortic, the pulmonic, tricuspid, and the mitral. And I'm going to listen to the same thing with the bell of my stethoscope. Okay, so I'm hearing S1 and S2, no abnormal sounds, no heart murmurs or extra sounds. So I'm going to move on to the abdomen. I'm going to get down and see the abdomen looks flat. There's no abdominal distension. I do see the aortic pulsation right here. So I'm going to listen to the bowel sounds in all 4 quadrants. Okay. Okay, and with the bell of my stethoscope, I'm going to listen to the aorta and the renal arteries. And I didn't hear anything with the aorta or the renal arteries, which is a normal sound. There's no bruit present. And now I'm going to feel your butt. Oh, also, while I'm looking, I do see that you have a belly button ring on the umbilicus. There's no signs of infection. It's not red. It looks normal. Have you had that for a long time?
10 years.
Okay. So, yeah. So, do you have any pain in your abdomen?
Lower.
Okay. So, I'm going to do some light palpation. Let me know if you feel any pain. So, I'm going to
Right there.
You feel some pain right here?
Mm-hmm.
So in the lower right abdomen, there is some pain. And then also I'm going to do some deep palpation, but I will not go to the lower right because I know you said you're already in pain, so I'm going to document that. Okay, so that's it for the abdomen. I'm going to go to the lower legs, or
Okay.
the lower body now.
Yeah. Socks off for you.
Okay, so for the lower extremities, I'm going to feel here.
Okay.
And then I'm also looking for any edema. So I'm feeling here. And now I'm going to do the pedal pulses. So they're +2. I'm looking for any lesions or any varicose veins in the legs, any bruises. There are some bruises right here that I can see. But nothing in the lower legs. Okay, so now I'm going to assess the range of motion. So can you pick your right leg up and hold? Okay, so 5 seconds. Can you go your knee to your chest and back down? And then your leg out towards me and back. Same thing with the other leg. So 5 seconds up. Alright, 5. Here, back down. Okay, now out and back. And then can you also pull against here, push against. I'm looking at capillary refill, less than 2 seconds. I'm assessing under here. There can be a lot of sores there. There's nothing. Now I'm going to do the Babinski reflex. So I'm here. I'm looking for any movement in your feet. Not seeing any movement in your feet. Okay, so now can you sit up on the edge of the bed?
Yeah.
Okay, so now I'm going to move on to the neurologic exam. So I have, this is clean, and it's just, it's a cotton swab. So can you close your eyes and tell me when you feel it?
Yeah. Now, 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 now.
Okay,
Now.
good job. And now I'm going to do it's going to either be sharp or dull. So you'll feel sharp or a dull pain. So close your eyes.
Sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp, sharp, dull, sharp, sharp.
Okay, good job. So now if you could touch your finger to your nose and then touch my finger. Alright, good job. Okay, so now if you could stand up and just run your heel against your other shin. Same thing here. Okay, good job. And if you could close your eyes and make sure you can keep your balance. This is the Romberg test. Can you also walk across? Okay, so I'm looking at the gait, normal gait. Can you do heel to toe walking? Heel to toe balance is good. Now if you could sit down. Alright, so I didn't bring my hammer, but I'm going to do some reflexes. Okay, so your fingers are moving. Okay, so also I'm going to do your legs. This is my favorite one. Okay.
You're good at it too.
Good job. Alright, so if you could stand up again. Now I'm going to check the curvature of your spine. So I'm seeing that it's convex and concave. So thoracic, convex. The lumbar is concave. So can you also bend over and touch your toes? So I'm seeing this C shape, which is normal. And then can you grab your hips and turn. Don't move your hips. Yeah, good job. All right, and that's it. Thank you.